Okay. Hello, everyone, and welcome to another episode of the Career Talks of EIT Health Alumni in the RIS region. We are covering in this series interesting stories how you could also, build up your career by the tips and tricks and the stories from our guests who have been already studying healthcare in the past, but also established a career. And I'm very happy to have with me today Jana Prauseova, originally from Czech Republic. She was getting her first degree in the Charles University there in the public health, and then she was studying in the London School of Hygiene and Tropical Medicine, the topic of control of infectious diseases. And today she's dialing in from Kampala in Uganda, where she's currently working there with the Shifo Foundation and is trying to digitize primary healthcare in order to bring down the mortality rate from preventable diseases. So it's going to be a very interesting episode. And as you can hear from Jana's story, this has been going from one bit to another. So this is also hopefully giving you the tips how to move your career from one place to another. But without any further ado, Jana, welcome to the episode.
Thank you so much. And you nailed my name, so I'm very happy about that. And I'm happy for you as well. I know it's quite a challenge. Yeah, thank you so much for having me.
Yeah, so maybe in order to give the start, maybe I went down very briefly, but maybe to introduce you a bit more to the group of people dialing in today, or maybe watching the replay on YouTube, that what are you currently working on, and maybe also a bit the story, like how did you end up there, because this seems to be quite far from Europe. I think you have been there before as well, as you mentioned. So maybe to give a bit inspiration for our listeners that
Sure, I don't know what inspiration it is, and sometimes I am asking myself how did I ended up here, but so you said it actually very nicely. I was studying in Czech Republic. I was studying public health for my undergrads. And during my undergraduate studies, I really wanted to get a first-hand experience, because what public health is in general, or what global health is about, is the health of the population worldwide. And I was feeling that I'm a little bit stuck during my studies, because it was mainly focused on Czech Republic, which is no one's fault. Obviously, it's a curriculum in the Czech Republic, but I was needing something more. So I thought, why not to get the first-hand experience myself? And when there was a summer holiday, I decided to do an internship. And luckily, the university allowed me to do it. So I just applied for a few hospitals in different corners of the world, sent them an email, and they replied from Uganda that I'm very welcome to come to the hospital to do the internship, even though it was the first year of my undergraduate studies. So literally I had no knowledge. I was just pretending, but it got me to where I am right now, so I'm not complaining. But I went to Uganda for 3 months, and I was working in a hospital, mainly with health management systems, immunizations, but I was also kind of part of different departments. So it gave me a really nice view on the healthcare system in developing countries, and I got really interested into it. So that's why I decided that not only I want to do an internship from Uganda, I also want to study here, just because the education in Europe is outstanding. However, it's usually second-hand knowledge, or it's passed from a person to another person, and then they pass it to you, which sometimes it brings the value down a little bit. So starting from here, listening to people and professors that actually are part of the community and part of the healthcare system, and they have a first-hand experience, it was like more valuable to me. And also being at the community of the students. So I came back to do a semester from here, and then I went to Czech Republic to finish the undergrads. And then I got really interested into infectious diseases as well, and I wanted to get more of that area and knowledge. So I applied to London. I studied in London, and I still consider myself a freshly graduate, even though it looks like or seems like it's been ages, but I didn't have my graduation ceremony yet. So I still feel like I'm part of the university. But I graduated last year only. So my career has been very short, but very fruitful, I would say, so far. So yeah, after London, I got the amazing opportunity to be part of Shifo Foundation, which is a Swedish healthcare innovative organization. And the organization works in different countries across the world. And the idea or the way that they work is that they want to change the way the healthcare system is done in those countries. And that is mainly in the area of data collection and data use. But this goes far beyond that. It goes into improving the healthcare system of that country. And it has more opportunities. If you have that data, you can ultimately change how financing is done or how incentive of health workers is changed and the performance is improved. So that's what I've been currently working on. And that's what brought me back to Uganda, because Uganda is one of the countries that we work with. So we work closely with the Ministry of Health to strengthen the current system. And that's why I'm here.
Well, this sounds super exciting. Like, I mean, like working basically like fully digitizing a country far away. And I think this is sometimes the underrated part that, or maybe that's like the, what do you, I mean, you have been now working like basically know the Czech healthcare system, probably the British one and Ugandan one. I'm wondering, like, from your perspective, like, is it easier to kind of digitize something that maybe don't have those legacy systems, or pushing the innovation in the countries where you do actually have those legacy systems and innovation?
Absolutely. Yeah, and I'm actually very glad that you mentioned it. Of course, it has its own challenges and ways, and I wouldn't say something is like more simple than the other thing, because it has different obstacles that you have to overcome. But it's definitely easier to start here with something, because if you want to start with something in Europe, or at least I'm giving Europe as an example because I haven't been anywhere else, but those legacies and like protocols that you have to follow, I feel like they mainly demotivate you from actually changing something, because it becomes a lot of paperwork and politics. But here, I mean, I'm not giving it as a great example, but we just walked into the ministry being proactive, interacting with people and getting things done. Obviously, as I said, it has its own ways how you have to do it, but it's much more active in a way, and you feel the impact more, because I feel changes that are done in Europe healthcare systems are very little, because the system is already built and there are a lot of directions to it. Of course, it's built here as well, but the changes that you can make are much bigger. I cannot digitize the whole immunization system in Czech Republic, or it wouldn't happen like this, you know? But here I can say that I can digitize the whole immunization system. It's like different opportunities and perspectives.
it's and that sounds very exciting. I think, it's like probably like working in an early stage startup, but it's like, working in an early stage, creating digital strategy for a country, which, must be exciting. But maybe let's take, I would say also one thing that any of you dialing in today, when at one point during our discussion, you would like to ask a question from Yancha, you can use inside the Zoom, the hand function. You can raise the hand, so I would see that you would have a question. Or if you are a more shy person, you can also put the question in the chat, and then I could read that out. But in any case, don't be shy, and feel free to tap into the discussion whenever you like to. But moving maybe a bit back, the story of yours, you mentioned it was like, you went to school in Czech Republic, then you applied to this, you sent an email to a few hospitals, they said yes, you applied to the school, it said yes. Was it really that easy, or like you got some no's on the way as well? Because I know that I personally, when I have applied to places, I remember I have got a bunch of no's as well on the way. So what's the true story? Like this was like a smooth story, but like
you made me feel like I was lying.
No, it's just like, there is always the Hollywood version where everything is super nice, people looking in the city, but sometimes this must be really hard work. I mean, this seems to be too easy to be true, that you just make a few applications and get to change the full country's immunization program, as I said. So maybe here, I think some people dialing in today or watching the replay might be in a bit different position where, I don't know, Ivan or Rostam or Patricia, Alexandru, others, they might have had less smoother ride. So what's your secret to get all the yeses out?
No, there's no secret. It's a natural charm, No, I'm just kidding. Obviously, it has been a rocky path, and I'm just saying it in a simple way. Also, because I don't want to discourage people. If you would say like all of those things that you have to overcome and what went wrong and so on, sometimes it would just demotivate the people to even try. But I feel like trying, being proactive, communicating with people, even though you receive the answer no, it's not a failure. It just brings you to the next step. So you should learn from that. Or if it doesn't provide you any learning, just like move forward and try something else. So no, but it has been rocky path. I didn't just send emails to hospitals. Actually, I did, but getting the fundings, releasing myself from university as well, because there was no partnership with the hospital, there was no partnership with the university, and there was no opportunities for me as a public health student at the Charles University. Unfortunately, now it's changed, and I also tried to change that. But at that time, we didn't have any opportunity to travel abroad. So I had to start that path myself. But I think that I was dedicated to do so because I was doing it for myself. I was excited about it, and I knew why I'm doing it. So there was not a point that I would feel like I want to stop or it's not worth it. Whatever I had to do for it, like administratively, financially, was worth it.
So but that this means that you like, if there is no university partnership, that you actually had to kind of finance. You said like you went there first time during the undergrad, that was like, on your own expense, not using any kind of grant. Or
so partly because, and this is exactly what I try to say as a message, is trying to be proactive. And if you do not ask the question, you cannot expect positive answer.
Yeah.
So I kind of calculated how much it would cost me, like everything all together, and then I try to see what Charles University provides as a support to students, what my faculty provides as a support to students, and none of that I wasn't eligible for these. However, I walked into their office and I said, you do not provide public health students with this opportunity, but I have this and I really want to do it, but I cannot afford it, so I need funds, blah, blah, blah. So this is how I got there. And then they I received 4 scholarships in total, I think. So most of it was funded by the university in the end. So if a paper says no, it does not necessarily mean a no. But oh my gosh, if some university people are watching this, they will really not be very happy. But anyways, this is the reality. So, but me being in Uganda doing this internship and university, I wanted to allow it to other students as well, because I think it's very valuable. It's an amazing experience. So we started a partnership in between the university and the hospital. So now some of the university students can come here and do the same internship. And I was also in progress of like exchange program, but honestly, I didn't finalize it. Maybe I should start again. But yeah, it's being built upon.
But this sounds super exciting. I think, and I think this is a good tip for any people watching us today or watching the replay. That I wrote it down that if the paper says no,
please don't take me too seriously.
No, but I think in the end this is true. Like like sometimes people feel that the European regulations and whatever, like they are even regulating what's the shape of banana you can eat. But in the end of the day, people have come up with these regulations. So also people should be able to change it. And in that sense, when something says no, you just have to find a person who has the authority to change and make it yes or maybe or
absolutely. And that's what I really adore about the organization that I work for now. And it teaches me a lot as well, because in Czech Republic, like you cannot just walk into the ministry and present something or try to change something. Like there is a protocol. You're not allowed as a public person walk into the ministry, but here I think that you're also not allowed. But again, like if the sign says no, you can just walk in and try and start communicating with the people. And I feel like that's how the organization works a little bit as well. They're not afraid of these huge opportunities or things. Like they just go straight into it, and whatever comes, they just deal with it. But they have the same aim and goal that they're going towards. So yeah, it has been an amazing journey and experience.
Well, it definitely seems so. Like converting and leading the new way. One thing I'm also thinking, maybe I know that sometimes when people they go to those new countries, you said it was your first time to get outside Europe. When you went to Uganda, you probably you did study it before in a textbook. I mean, how was that kind of like reality check? Because I think also when people, you said even in case of learning the medicine, that often in the European schools you actually like getting the second-hand knowledge. How was that second-hand knowledge helpful, or really you had to kind of like build up everything that, or let's say relearn the things that you had learned in Europe going to a new continent?
Yeah, that's a very interesting question. It's a huge topic, I think, and I don't know if I can answer it like with one sentence only, but
you have
course,
to.
Great, thanks. I mean, of course, the theory is crucial. Without theory, you wouldn't really be able to do practice. However, I feel like with practice, you get a lot of the theory by just doing it. So if I compare the Czech university, the medical university, and the internship, for instance, that I did here at the hospital, at the Czech university, but I wasn't a medical student, I was public health student, so maybe that's also the reason why, but we weren't allowed to work with patients because of regulations, and obviously there is a reason why. I'm not saying anything against it. However, medical students, I think that they start after a few years, or maybe like sometimes at the beginning. For us, there was no interaction with patients. So I was only studying everything from book. That's why I wanted to do the internship as well. When I came here at the hospital, I told them I'm still a student, so I'm not allowed to do anything. And they told me, what do you mean you're not allowed to do anything? You're a student, your reason, or the reason of your existence is to learn. You will not learn by reading a book, you will learn by working with the patient. So the first day, they told me there was a patient that needed to receive antibiotics with the IV. So they told me, oh, there's this patient, go to him, give him antibiotics over IV. And I was like, I never even injected a human being. How am I supposed to do it? And I'm pretty sure that I'm not allowed because I don't have any qualifications to do so. But they're like, no, but you have to learn, so go, next time you will do better. So I have a photo actually of that patient and me, and I don't know who was more scared to do it, you know. I love that photo. But anyway, so there was a nurse standing next to me and she was just telling me what to do, and I suddenly injected a person, gave him antibiotics, and luckily nothing went wrong. The patient is still alive. It's actually my friend now. So it went good. But yeah, the difference I feel like is that you have the healthcare is based more on practice here, I think, but that's also because the settings allows it. Yeah.
So
that's the conclusion.
it's like everyone who is listening in today and are currently still studying,
They will put me in jail because I'm not supposed to do this if I don't have any qualification.
But I think this actually kind of makes sense, because really, like, I think, yeah, again, I might be politically incorrect, but sometimes I think in certain systems, if they are lacking staff, if they are missing those people, probably people would die. Like, if I mean, they just don't have enough resources, and then it's like, if someone is motivated to help, that already can make a difference. Yeah, there is a risk, but
Yeah, I also feel like they allowed me to do mistakes, not on patients, like I didn't do any mistakes on patients, but I got involved in the health information management systems and immunization, and I saw a huge challenge with data collection because it's all paperwork. It takes a lot of time for the health worker to fill in. There were like 6 different registers where you basically fill the same information of the client, while that client is basically sitting on the chair waiting for you to finish the administrative task so that you can vaccinate them and let them go. And I saw this as a huge challenge because for us, like, it's mostly digitized. You get that if you go to the doctor, most of the time, it's your interaction with him, not his interaction with papers. But here it was otherwise. So I saw it as a challenge, and I really had that need or urge to do something about it. And I feel like it also brings the difference for European innovations and innovations in here, is that they just allowed me. They told me, if you want to do something about it, do it. Like, we will support you. You can be free to map the processes, ask questions, pilot it, and see how it goes. So that's what I did. But I think that if it was a hospital in Czech Republic, I would be very limited to change the current system or try to pilot a new solution.
Yeah, maybe even like the fact that you have been, for example, that you had to do that, injection with a syringe, that, and then probably fill in the paperwork later. You could see how frustrating the paperwork is.
Yeah,
That,
it is
very hard.
And you make a lot of mistakes writing, as well. Yeah. So
because when you have been in that position, like I have a pen in my hand, it's the virtual camera is hiding it, but probably it's a different experience if you're a bystander, that if you are just shadowing there, like, observing how they are doing things. But if you really kind of have to take that needle in your hand and then spend 10 times more time with a pen than with a syringe, you kind of notice that, like, oh my God, like most of the time I'm holding a pen, not the syringe. And like this kind of like, gives you a different realization than, just like trying to observe like what's going on.
Absolutely. And thank you for saying that, because this is exactly what I learned during my current work in the organization, is that you cannot innovate something or develop something based on assumptions. You have to make it based on observations, because if you assume that the health workers spend a lot of time, it brings new challenges that you would not be able to see because you haven't actually observed it yourself. You haven't interacted with that health worker and asked, or you didn't do it yourself. So, and I still struggle with it. I feel like in some parts of my work, I still just assume what the process is, or, but I don't actually make it. I don't have it written somewhere, or I don't ask. So yeah, it's a learning process.
Yeah, but sounds very fun. And maybe I have in that relation, I have one more question. That in your case, maybe it seemed to be very kind of fortunate that you were studying and then you somehow found a job now that you are really enjoying. But I think some people watching us today, or maybe watching the replay a month later when they have already graduated in the end of June, and now let's say they are going to apply to a position somewhere. So do you have maybe some tips how people could find a job as fulfilling as yours? Like, I mean, maybe what is the trick that really, like, look for a job? Because, like, sometimes the job descriptions there is like, 5 pages what you have to do. It's really hard to understand, like, what does it really entitle to? In your case, it seems like, you cracked it, found a great place where you can, like, try out things, be very fulfilling. But the people that are graduating this summer, what's the trick that they could try out to really, like, have a good match with their skills and their expectations, and then whatever they would be doing, let's say starting September onwards?
Honestly, I wish I knew. I don't have a trick. For me, it was a very rocky journey, and I was always very proactive during my studies. I knew what my direction is, where I'm heading, what is my goal. And I did everything possible towards it while I was still studying. And I thought, thanks for my proactiveness, I'll be able to find, like, the job that really fulfills what I'm looking in a job and brings a lot of value to it very easily. And it was not easy. And I was so surprised how much I struggled. And also, in a way, it affected my mental health at that point. But I feel like most of the reason why was COVID, which I don't want to make it as an excuse, but it's an actual thing. I think that people are underrating it. I did all my masters during COVID. So all of my classes, the whole year, was on Zoom. And you need to interact with people, you need to make connections in order to move somewhere. And no matter how hard the university tries, no matter how hard you try to be active during those Zoom calls, it's still a Zoom call like this. and it's hard to make these friendships and connections. So I really feel like I missed out a lot being locked in your room. And I spent 2.5 months in self-isolation in students' accommodations in London. So I know what I'm talking about. It was not fun. I needed to call reception to boil water so I can make tea in my room. So it was not fun. So it really affected my mental health. But it really affected me seeking a job, because I feel like most of the things that get done are by face-to-face communication, not email communication, not nothing. But I tried to make as much out of the connections that I already had. So I was looking for a supervisor for my thesis, and everything is connected together. In Uganda, I was working on immunization, health management systems. This was my thesis on as well. My supervisor, Dr. Claudia Hansen, she's connected to my London University, but she's also connected to the current work that I'm doing. She's also connected to Uganda and the health management and information system. So thanks to her, because I checked her profile and the bio, and I saw like Shifo Foundation, which I currently work for, and I opened it and I saw, oh, this like is exactly what I was doing in Uganda. However, when I was doing it wrongly, because I assumed, but they're doing it better because they observe. So I went through that website, I got really interested, and that is my tip. Like, if you really feel like something is for you, just be active and contact the people, because by reading or looking or waiting until that organization posts a job for you, that won't happen. And I've been there. I did infectious diseases, so I wanted to work for organizations like WHO or ECDC, and I was just looking into the open positions, and I didn't find anything that would suit that I would be eligible for, even though I would really love to do that post. For instance, I didn't have 5+ years experience, so suddenly I just turned it off and was like, no, I'm not there yet. But with this organization, I just felt it, and I was like, no, you have to contact the people, otherwise you will not get anything out of it. So funnily enough, I just texted, like on LinkedIn, I opened the organization. I clicked on is it like employees or the people that work for the organization? Yeah. And so there was Sarah, for instance. She was studying at London School of Hygiene and Tropical Medicine. So that was suddenly something that we had in common. And that's how I started the conversation. I was like, hey, I'm really interested in what you're doing. And we were, by the way, studying at the same university. So that's how you have to do the ice breaking kind of like. Absolutely. And I texted Joseph as well. And Joseph actually replied to me, and he said, let's go for a coffee. So we went for coffee, and then he got me in touch with our wonderful leader and CEO, Rustam, and then we had an interview, and then he connected me to other people, and I'm currently in Uganda working for them. So I guess I don't know if that's a trick, but if you really want something, just talk to the people. Don't expect that they will post something ideal for you. Yeah,
I think that's spot on. And sometimes when they post, do they even know what they want to get? No. Sometimes I have been like seeing some kind of job offers, and I it really kind of if you look through all the requirements, it's like, does anybody exist like that? I mean, I think like a few months ago, you mentioned that WHO. I was checking something on WHO website, and I saw they were looking for somebody in digital health. I hope nobody, WHO, if you're watching this, it's like, it's year 2021 maybe, and you look like somebody who has experience, more than 20 years of experience and 5 PhD degrees in digital health. And I'm like, I don't remember that there would be digital health like 20 years ago. Like, I mean, how can they find somebody like that? I mean, it must be maybe like 1 or 2 persons.
That was
if
called,
if any.
that was called telemedicine before it was called digital health. And in between something like e-health, at least in our country.
Yeah, same. Yeah. No, but I struggled a lot with this, and that's why I actually, like, thanks to the LSH University, we had an opportunity to talk to a career advisor. I don't know how the position was called, but I really struggled, and exactly, I was so demotivated by seeing all those posts jobs, and I wasn't eligible for any, yet I knew that this is something that I'm very passionate about and I can bring the value, but how would I prove it to them, because I have no or very little experience, because I'm still a student. Like, what do you expect me to do, have 5 years of experience when I'm still studying? That's, impossible. And there was no young professional jobs, even for ECDC or WHO. They have young professional programs where you're basically like 2 years as a trainee or a fellow, like working in different areas, getting to know the organization, and then maybe you'll be eligible to apply for some of the jobs. But Czech Republic is not on the list of partners for the young professional program. So I was like, it's not even my fault, so how am I supposed to get into this? So I had a call with this career advisor, and he was amazing, and he told me exactly what you said. Most of the posts that are posted, they don't even know what they want. It's just standardized kind of requirements. But unless you contact them and you show them how passionate you are about it and what you've done so far, you would not get a positive answer. You would just close the tab on your internet and continue, so
and I think that's actually the motivation that sometimes maybe when you're working on, like, I mean, as you are currently working on basically creating something new, this requires this kind of cold outreach. So probably, like, if they see somebody that is willing to make those cold calls, like cold outreaches, to get the position, probably they could apply the same thing while they are working, and they are not afraid to kind of reach out to people, get no's, maybe get yeses, to stand out. I remember a few years ago, I had to hire a person, and I was talking with my colleagues. There was a list, and there were like few candidates with PhDs, but in the end, I hired somebody who was actually also like maybe not qualified per qualifications, but who was super eager, and I thought, like, I need that energy more in that position to fill that role than any qualification who is boring, and like it's like doesn't bother that, like, hey,
absolutely. That's how I felt during my interview with this current organization as well. Like, I wasn't asked questions regarding how many years of experience I have and like these types. I was asked like more of my understanding of the topic and what I would bring as a value, what I would change, what I see as challenges. And it was like a very open discussion where you felt it was a very nice, safe environment where you could just share your opinion, but that's what the work is about. You're trying to figure the way, and sometimes you fail, sometimes you don't, sometimes you succeed. But yeah, the interview was not based on CV, kind of. It was more based on your mindset and your perspective and thinking. Yeah, I think
maybe where you want to head to, because I think you mentioned that also, like, what was guiding you was that you knew the direction you want to head. And actually CV is more like, what's the history like? I mean, what's the thing you did 20 years ago, 10 years ago, 5 years ago? 1 year ago, but it's not really indicating the direction you're heading to. So
absolutely.
But maybe regarding this direction, I know that maybe some people watching us today, they might have struggled like maybe defining that destination. Like I understand in your case, the good thing was that you knew the position.
Yeah.
I mean, you wanted the destination you wanted to head to. Do you have, I don't know if you had this already when you were like, I don't know, in primary school or before that, that destination, but do you have maybe some tips how to set that destination in your internal GPS, trying to navigate through your career? That what are the comments people have to kind of code in or type in to find that destination for themselves?
I'm actually, again, very glad that you asked, because even though I'm saying here how I know what I want to do in my life, where I want to head, what is my goal, like it was not always like that. And I struggled a lot as well. How I got into the healthcare, I don't know. I think it was, high school is a huge impact. I guess people that are around you are also a huge impact. For me, what I think the beginning was that we had an amazing teacher for chemistry and biology. That's why I really got into that subject, because I felt like I'm gaining a lot of knowledge and I'm free in learning. So I think that's where it kind of started, where I got into health. But I knew what I want to do in my life, I guess. I was very passionate about the health of the population, developing settings, humanitarian settings. I was very into, and I'm still very into, Doctors Without Borders, MSF. It's my ultimate goal to be working for them or for WHO. So that was in my mind. However, how to get there, that's the issue. And I think with most of the current students, I think it's the same. Like maybe you know what you want to do, or you have that kind of image, what you want to be. However, how to get there is a challenge. And for me, it was a hell of a challenge. I don't know why, but in my mind, if you want to do healthcare, and I think it's impacted by European system as well, is you need to be a medical doctor. So I was not necessarily interested into medicine as medicine, because I was interested in this global health perspective of it. But I thought that how to get to this global health perspective, I need to do medicine first, because I need to be a doctor. And also in my mind, to get to the highest position possible, having MD is the top. So that's where I was heading. And I was a really good student, I would say, or maybe my high school teacher would disagree, but I think I was. So I applied for medicine, and I feel like a lot of people expected that I'll get into it. And even I was expecting that I'll get into it, because I mean, I was a good student. I knew chemistry, I knew biology. I wasn't preparing that much, or not at all, because I was really just expecting that I'll get in. And I wasn't accepted. And that was a huge slap in the face, I think, because I realized like I cannot just expect things to happen. I have to work for them. So I wasn't accepted, and I didn't have any other choice, because as I said, I thought that I would be accepted. So I spent a year, I don't want to say trying to figure out what I would want to do, but I was like having a little bit, I sat with myself and tried to find another way, because I realized that medicine is really not the way that I want to get into my goal. There are other ways that I didn't know before, like public health, for instance. That's how I got to know about it. But I was also working for MSF at that time in Prague's office. Even though I was just a volunteer and I was helping with administrative tasks, it was still an experience that got me somewhere. So thanks to them, I talked to many people that worked for them, and I heard their journeys, and I got to know that there are other aspects of healthcare, not only medicine. So that's how I got into the public health, and I finally found the way the direction that I'm heading, and I know it's right. So your question was, what was the tip? I don't know.
Well, but I think this is actually maybe, I mean, I liked chemistry as well. And I think one thing I remember from the chemistry studies is maybe something now you did was, but using kind of like catalyzer, or, you know, because one thing you study in chemistry is that if you want to kind of synthesize a compound, there is actually usually more than one reaction to get there. So in that sense, that it's like, okay, I don't have resources, or like this reaction, like I can't conduct for whatever kind of reasons. Hey, let me try the reaction number 2. Maybe you have to kind of do another compound in between, but then you're like, you know, overcoming that activization threshold, so to say, that or the like whatever restrictions that might be. I mean, you can't generate enough pressure. Okay, let me take a route that it doesn't require pressure, or something like that. That as a chemist, and you're studying chemistry, that you can crunch through a chain of reactions to get to that compound, or in that sense, health destination.
Absolutely. You should post this on your LinkedIn. Very well said.
Well, I mean, I remember when I studied chemistry, one of the professors used to say that, I mean, the guys who are studying chemistry, usually they know how to manipulate with molecules. They can do anything, because like if they know the smallest particles and work them out, I mean, they can work out the bigger stuff as well. So yeah, that was a good professor.
I guess it works like that in life.
We have been now talking for quite a bit. Do we have any questions from the audience? Ivan, you had a quick jump in. Do you also want to do another jump and ask a question from Yangcha?
Yes, then Ivan, please, then I will continue, please.
No, I don't have any more questions. Thank you for asking.
Okay. Beata, you have a question.
Yeah, I have a question that what do you think about language skills? I mean that do you develop your language skills in other languages, or at this moment do you focus on English skills?
English is definitely very important. I would lie if I would say no, because that's the official language worldwide, and now the generation, most of the jobs involves English. So for me, I mean, when I was in elementary school, it was already part of our curriculum. So I had it. So I was lucky. My parents were not, I don't want to say lucky, but they're studying Russian at the time. So now they struggle to travel or communicate because they don't have, and it's very hard to learn a language from scratch if you're not a child anymore, because you don't have the brain capacity and ability. But my brother, luckily, he was a great role model to me, and he knew that English is important, and what is in school is not really enough, because again, it's just books. It's not an active communication. Most of the times the teacher is Czech, which I have nothing against, but obviously having a native speaker brings you to another level. And he knew that, so he organized for me classes of English even outside of the school, which at that time I really, really hated, because, you know, like you finish school and then you have to go to another school. Like, why would I do that? But now I really appreciate him a lot. But I feel like other languages are becoming more and more important, just because before, having the English ability was precious and was highly appreciated. But now you're expected to know English. So if you have another language, it's an asset, it's something more. And especially in healthcare, I feel like if you look at the UN languages, what they're looking for is French, it's Spanish, it's Arabic. So if you have the opportunity to learn the language now, do it, just because there's no way it would not be worth it in the future. So I don't know. Does it answer your question?
Yes, absolutely. Yes. That was what I'm interested in. Thank you.
Yeah, so maybe that's another tip for anyone like listening us today, that if you don't know what to do this summer, take a language class in any of the UN languages you are not mastering yet, that to get an extra points maybe on your application to WHO or something else. But I think it's also like what actually I sometimes connect with languages is that I wonder, I have noticed that there are certain things that I can express in Estonian, for example. This is my native tongue, but there are no matches in English in that sense. Or like, there are certain things that I can express maybe in German or Russian, which it's hard to define in another language.
Absolutely.
So sometimes probably, I'm not sure about, I also don't have the MD, but I can imagine that there must be something also in healthcare that is in that sense localized, that probably when you're dealing with patients, being closer to them or talking to them in the language they understand definitely should be making things easier.
Yeah, well, here in Uganda, they mostly, they have like 50 different languages, but
50?
mainly
like 15 or 50?
50. It's something, maybe even more, I don't know.
Wow.
Yeah, but so it used to be a British colony, so English is the official language, I think. However, Luganda is the most influencing language because it's in Kampala, around Kampala, and then obviously people travel, so they also spread the language farther. But anyway, so yes, in English is in a way very actionable language. It's not that fruitful and colorful. It doesn't have that many expressions. If you have one word, you just describe it with one word. I'm starting to learn Arabic now, and I see the huge difference. Like in Arabic, you want to say, I don't want to say examples now because I speak very badly still. Well, not speak at all, but you have like very different ways how to describe it, and they don't necessarily mean the word, but they, anyways. So with English and medicine, sometimes here in Kampala, it was a struggle to describe what the patients need or what I need. And I usually had a nurse that, even though the patient speaks in English, they would describe it in Luganda just because it feels more familiar to them. So then I had to say, like, I don't know what you're saying, and someone had to come to translate it. But yeah, even the English medical terminology, I didn't study healthcare in English for my undergrad. I studied in Czech, and I see it as a huge disadvantage because all of the people that I know that studied healthcare in English have way better ability to talk in healthcare settings. I had to learn those words. Like, of course, some of them are similar to English because they're taken from English and just Czechified. That's not a word. But some of them are not. And sometimes when I went to Kampala to study, during the classes, they were talking a lot of terminology and I didn't know it. And it made me look like I don't have the knowledge. But I had the knowledge, I just had it in different language. So I didn't know what they're talking about. So many times, like we did physiology, for instance, the professor asked me questions, and the reason why I didn't answer is not because I don't know the information, but it's because I don't know the words. So that, took me back a little bit.
Yeah, maybe in the future, like when, we are digitizing those things and you're working on a digitizing, hopefully some of those digital solutions can help to overcome those language barriers as well, that helping to put those descriptions, because when people maybe are describing the pain they have, it's like it's better to specify what kind of it is. It's like as part of the diagnostic process.
Yeah.
Of course,
I also feel like it's it's just also important to, if you develop something like this, to also try to deliver the message in the local language, just because it puts more emphasis on the message. So yeah, when you talk healthcare innovation, you should always observe the settings and understand the settings in order to really develop something that would bring value.
Yeah, because in the end of the day, like, patients, it's not only diagnostics, like one thing to understand them, but also like when you're giving instructions, hopefully they would understand what they really have to do. I think one thing I observed during the COVID-19 pandemic was the challenge where the health authorities, the WHO and others, they were like, producing those, 8-page font 10, like super complicated instructions on the weekly updates. And then you were trying to, like, if you don't have MD, you're like trying to read this through, like you can't really understand. And some of my medical colleagues, they sometimes say that, when their friends are going to see a doctor and they get the paper, they don't understand a word. So they take a picture and send it through WhatsApp to kind of, it's like, can you actually tell me what's wrong with me?
Yeah.
I don't really know. I got this kind of.
It happens all the time. Yeah. Even some of my friends were sending me photos like, can you explain this? And I was like, I'm not a medical doctor, I have no idea what it says. But I have a great example actually of my current work. My great friend and colleague, Kenneth, we did capacity building of the Ministry of Health people and some other implementing partners on our solution. And I mean, I'm still learning how to present and deliver the information, but that's never ending learning process. However, I was like saying something and then there was not much interaction coming back. And then Kenneth stepped in and he said exact the same words, but in the local language. And suddenly they like, I guess it's because they're more familiar. It's something more closer to them. So they tend to interact more. It brings down the shyness, even though English is official language in here, but it's not your like mother language. So yeah, sometimes it's very surprising to see how the language barrier affects the understanding.
Yeah, awesome. I see that this has been very cool discussion with you. I see that the audience is a bit shy today. Maybe we are too energizing, like sucking all energy away from this room. But is there also a way that, I know as some people are shy, how people could reach you out? Maybe some people sadly had to miss this session because they had another engagement or something, but are watching this replay on our YouTube channel and they maybe got in the last minutes a question they would like to ask you. Is there a way they can reach you out? Should it be like your LinkedIn or just like trying to, should they hustle like in a way as you did? Like it's like, I don't tell you my I don't tell you my email, but if you happen to find it, you're welcome to send me one.
No, and I like the point of the whole discussion today. I think my tip, one of the ones that I gave, is that you should reach out to people, right? Otherwise you're not going to get anywhere. So yes, any kind of communication, it can be email, it can be LinkedIn, it can be Messenger, it can be WhatsApp. I usually like when it's more personal, so WhatsApp would be the best. But if it's an email, I can also dedicate my time to officially reply to an email. It's fine. So I can provide you with anything.
Okay, cool. So I think we'll put the contact details. If you're watching a replay, they probably are in the comments below this video. You can just check out and get the link to the profile. To ask the questions, you couldn't ask in live. But this is also a learning point for everyone. maybe watching these series of talks that if you want to be next time part of this episode and ask questions, sign up for the newsletter of EIT Health RIS newsletter, the InnoStars newsletter, and then organizing next talks. You'll be the first one to know of all the next one, like opportunities to ask questions directly from the speakers. Unless there is no other questions, I'm very happy and grateful, Jenscha, that you joined us today and shared all these stories that were super exciting. If you would like really put it now, maybe some people are really busy and they have just like 1 minute, what would be the 3 points that you would like people watching us today to take as a home message? That, you know, in a TED talk usually have 3 points. What are the 3 points? I myself wrote down that one is like, if the paper says no, walk in. The second one is that you learn more by working with something than by reading books. So even though you like books, like just get your hands dirty. And that don't make assumptions, but do those real life observations. That those are way more valuable. And a bonus tip would be to learn a language whenever you can. Yeah,
that sounds good.
That's a good. Okay, so
yeah,
I
sums it up all. You passed.
I passed the test.
Yeah.
Awesome.
Oh.
Yeah. Well, thank you so much, everyone watching us today. If you want to have extra questions, as said, you can find Jenscha's profile in the comment section of the video below. If you want to see other episodes or learn the opportunities how EIT Health can support your ideas, or you want to learn more, like EIT Health is organizing also summer schools for PhD students and other training, just like subscribe to EIT Health newsletter and you'll be getting up to date of all the next events and opportunities we are organizing. Thank you so much for watching us today and see you soon again in a new episode.